It is like having a brain massage and calming down completely, and the noise is gone.
This is our humble hemp patch.
5,000 years of medical cannabis use.
We're learning about other cannabinoids.
Marijuana is grown in every state in the Union.
I'm Lex Pelger, Director of Education at CV Sciences, and this is the Lex Files. Ketamine is one of the hottest topics in the world of psychiatry. Originally used as an anesthetic for surgery, this drug became popular with recreational users as a dissociative. But in the last 10 years, it's become a subject of intense study for its ability to help with treatment-resistant depression, often in just a few sessions. Today, we'll learn from a celebrated therapist about how she uses ketamine in her patients with a history of trauma. Marcela Ot'alora is a psychedelic therapist in Boulder, Colorado. And while she helps to run the research studies on MDMA with MAPS, the Multidisciplinary Association for Psychedelic Studies, in her private practice, ketamine is the only psychoactive drug that she uses. Today, she'll share about what kind of benefits her patients see, how ketamine is different from other psychedelic medicines, and perhaps a little insight in how you can shape your own healing arc. Also, after the interview, we've included my short summary on the history and use of ketamine. And believe me, I think it's one of the most fascinating drugs in our toolkit today. Just to give a short preview, there's a reason ketamine is on the World Health Organization's list of essential medicines. It's one of the safest anesthetics used in surgery because it doesn't depress the lungs. When children go in for surgery, it's usually ketamine that's knocking them out. So it's physically very, very safe. But at high levels, it has an intense psychoactive effect. The effects are often called psychedelic, and they can feel that way, but technically ketamine is a dissociative. It dissociates you from your consciousness. At low levels, that's great for dancing. At medium levels, it's good for watching something pretty, or as you'll hear, to help someone deal with their trauma. And at high doses, you're in the K-hole. That's where your ego has been forgotten, and you're floating in some kind of other world, usually pleasantly, but not always so. So physically, you have this very safe drug used by anesthesiologists at high doses and therapists at medium doses. Then mentally, you have this incredibly potent psychoactive that feels unlike almost anything out there in our recreational palette, something that has real addiction potential, as well as a strong capability for healing. And so for these reasons, and more that you'll hear in the interview and in my capsule summary following, that's why I often call ketamine the great double-edged sword of our generation. So please enjoy this episode with Marcela Ot'alora. Hello, Marcela. Thanks for joining us today.
Thank you. Glad to be here.
So you're well known for your work with MDMA and doing research with MAPS. But I was intrigued that in your private work as a therapist, you predominantly use ketamine as the only psychoactive with people. And actually, the first question was going to be, for people that you work with who have never heard of ketamine before, how do you describe it to them, what it is and what it does?
Mm-hmm. So I usually describe, once in a while people will ask me more the neuroscience part of it, which I know very basic. But I think people want to know what's going to happen to them, like what's going to happen to them in their body. So, and what they know about it, if they know anything, it's that it's a dissociative. So then they're worried about that. Like, am I going to dissociate? And even for some people who say, wow, like based on my trauma, I dissociate anyway. And so, is that going to make things worse? And so sorry about the dog.
They're great dogs.
So my first point is to make that distinction of what dissociation is when it's based on your coping strategy because of trauma versus what happens in the dissociation with ketamine. And so ketamine is a dissociative from the body. So sometimes that's why it's helpful when they've used it in the 60s. They used to use it since the 60s. They've used it a lot for kids who are going to have like a procedure that is not really a difficult or long surgery, but it's a shorter, more simple surgery where they don't want to put the kid completely out, or the person and dog completely out. So they give them ketamine so that it's dissociating from the body and being able to do this procedure without putting them completely under. So if you think, so how does that help? What does that do? And what it does is it clears the space. So it's almost like it's such an embodied experience, but it clears the space of the body so that the boundary feels different. The boundary is not so closely tied to the periphery of our body. And because that boundary expands, then you can explore outside that boundary that you're used to. Does that make sense?
Mm-hmm. And so the dissociative action of the drug ketamine is different than the dissociation that therapists talk about, which is something I only learned from my wife, of that when people have severe trauma, they can just separate parts of their mind from themselves and go about their day. And that's what they had to do when they were in the traumatic experience to protect themselves.
Right.
And so it can sound like a scary word, and it's odd that there's a pharmacological definition and a therapeutic definition, and they're not particularly aligned.
Right. So I think once somebody makes that distinction, it's not that you're going to forget or that you're going to not know who you are. It is more that you're going to have an expanded awareness of your body and of your sense of space and of your sense of experience in general.
So what does it look like for you when you work with someone? How long are you doing regular talk therapy with them before you do ketamine? Then how do you prep them for how it's going to go?
I have different situations. Sometimes it's clients that I've seen for quite a while, and they're established clients, and maybe they're kind of stuck in some place where they can't move past that point. So I might suggest ketamine to see, to explore that place where they feel like they can move past. Sometimes it's actually a client who is somebody else's client, and they come to me for the ketamine work, and then they do integration with their own therapist. So they don't do the integration with me. If it's my client, then I do integration with them afterwards, and we really discuss what happened in the session, what is it, how is it impacting their life. So it's different kinds of scenarios.
And just an aside on the legality, how does it work with how you acquire the ketamine and dispense it?
Yeah, so I work with a physician who sees my clients that I refer to him, and he does a physical with them, and he asks them just different questions in terms of contraindications about ketamine and other drugs, or ketamine and other and conditions in the body. So if he feels comfortable with that, he will prescribe the ketamine, which then goes to a compounding pharmacy. It has to be a compounding pharmacy. The compounding pharmacy sends it to the client, not to me. And then the client brings it to the session and takes it. Like I don't touch it. I don't have anything to do with the actual medicine itself.
Oh, that sounds nice, actually.
Yeah.
How do people generally take it?
So to do therapy, to actually, there's different ways. Sometimes I think the part that people tend to know more is the infusion that is used more for depression, like really severe depression, and they don't do therapy in the moment. They might have a therapist outside or outside that kind of setting. But the way that I work with it is sublingually. And it could also be IM, intramuscular. If it's intramuscular, then I have the physician come in to administer the shot.
Okay. And sublingual would be a tablet.
Sublingual is a tablet, and they put it under their tongue. And it's mostly absorbed through the mucous membrane, so they keep it in their mouth without swallowing for 12 minutes.
Ugh.
It does not taste good at all. Everybody makes that face that you're making.
Yeah. Do you have a preference as a therapist for whether people take it as a tablet or they do the intramuscular that tends to have the quicker, faster onset?
I think it serves two different purposes. The intramuscular is faster and kind of takes you out of that space of your body faster, and then you have to navigate that space. And it's can be very therapeutic and very wonderful. And very wonderful. By wonderful, I don't mean necessarily that it's going to be like a pleasant experience. It could be a really challenging experience, but it's wonderful in terms of an experience itself of an ordinary state. Sublingually, what I like about sublingual, and you can even have a little bit of a higher dose and get to that place of the non-ordinary state, but there is then still that connection to me so that we can work together. They're very aware of my presence in the room, whereas depending on the dose, if you do IM, you might not be so aware. You actually don't want the person to be aware. Usually people say, oh, if it works, it means, did you leave the room? They say, did you leave the room? Did you really, were you not aware that you were here? And that's a good thing. But when you're really, and in that case, you would work with them after they start coming down from it, from the symptoms of it, then you can do the work. Sublingually, people can still be very quiet during a period of time, but they're also very aware of this relationship that is happening between you and them, and then they can start working.
And how would you describe what they're feeling? People probably hear more about MDMA and that love engulfing feeling that comes from that. How would that compare to what you think people are experiencing on ketamine, especially in a therapeutic setting?
Mm-hmm. So I see it as a little bit more of it's a mind massaging. It's like massaging your brain as opposed to massaging your heart, even though it has heart to it, but it's more like this brain massage, right? Like you're really exploring how you came to a thought, for instance, how it formed, how did my beliefs arrive at this particular place? And it's also very nonlinear. So it's not that, I had this experience and it must mean this and this and this in regards to my life. What I tell clients is what you want to be aware of is what happens to you after in terms of the way you interact in the world. Is there a change in the way you interact in the world? Is there a change in the way you interact with people, with situations, with your environment? Is there something that has shifted? So that ketamine is more that way. And the way so many of my clients describe it, they say, I feel like there was that it shifted my mind. That there was a shift in the way that I see things. That's the way they usually describe it to me afterwards. And the experience itself can have meaning and they can relate it to certain things, but not necessarily. It can be a little bit, it doesn't have to, in order for the healing to happen, it doesn't have to be, I need to figure out what that experience was. Why was I by a river? Why did I become a whale? Why did I,
It seems like it's more of a biochemical reset that you don't get to understand more than a story finding kind of experience like tends to happen with traditional psychedelics.
Mm-hmm. Yes.
And it really makes sense of what we know about ketamine, which is, I get both a lot and a little. I mean, the main thing we know is that it blocks the NMDA receptors with glutamate. And so it's kind of an overall mind shutdown the more you take of it. And that's why I was curious what you were going to say about how you decided how much to give to various patients. Because there's often the idea of the psychedelic dose versus the psycholytic dose. Mm-hmm. And the psychedelic dose is taking a lot and right. losing consciousness, but the psycholytic is taking in more minor amounts. So you know the drug's there. And then there's microdosing as well. And just like with MDMA, sometimes the lower dose is actually more effective for therapy. How does that work in your experience with ketamine?
Mm-hmm. I always start with 100 milligrams, which is actually a pretty low dose sublingually. It's a low dose. And it's what the physician that prescribes for me and I came up with in terms of like he prescribes 6 doses, like for 6 sessions. And he is determining that by it being 100 milligrams per session. Oftentimes, clients will go up a little bit to like 150, maybe even 200, maybe even 250. But kind of do it incrementally, depending on how it's really metabolizing in their system. And sometimes they even go down. Like I have a client who does 75, and 75 works very well for her. So it's finding the dose that works for the person, but 100 is sort of like the one that I start with. And then if they want a little bit more, there is a felt sense of like, yeah, I could have a little bit more, and that you could 12 minutes later when you do then swallow it or spit it out, then it's more like, okay, do you want a little bit more?
Oh, so even after that shorter time, you kind of know where you are.
You kind of know where you are.
Wow.
And okay, this is the peak, I mean, the beauty of ketamine is that it's short-lived. And so you don't have to save an entire day. Most people, 2 hours is enough.
Wow.
And so then by that time, the peak is there and you can go, okay, I'm here and this is good, or I need a little bit more to take me a little bit further.
And when you're watching people, what range of experiences do you see in terms of ones that are particularly beautiful and pleasant versus ones that are, appear very challenging?
Mm-hmm. I think there's a sense of sometimes the fear happens when there is a disorientation about where they are in the space. Like they're not quite sure where they are because they're not quite sure where their body ends. So if they don't know where their body ends, and for instance, the couch begins, that can be pretty unsettling and can cause some discomfort and some fear. And that can be alleviated pretty fast when you tell them, touch the couch and just rub the couch. Oh, yes, I am here. Or open your eyes for a moment. Oh, yes, we are here together in this room. Another one is that sometimes they feel they can't move. It's almost like, oh, I don't think I can move. And the reason why they don't think they can move is because they don't know where their body ends. But if you say, move your hand, and then they move their hand, they go, oh, I can move my hand. So in those lower doses, that can happen and can be alleviated. In terms of a really challenging, they can have a challenging experience that is scary of being lost somewhere, being alone, completely alone in a desolate place where everything is gray and I don't see another human being and I'm really, really scared. That's a common, or it has happened quite a bit where people do feel that sense of aloneness in the world. And then what do I do with that? And I do encourage them to stay with whatever comes up. If it's joyful, if it's challenging, it's like, okay, here you are. This is what is happening in this moment. And I prep them with that. If it's going to be less challenging if you don't fight it. It's going to be way more challenging if you try to get out of it, right? And it's going to pass. It's going to pass. And the impetus that took you there is going to bring you back. It's going to bring you back for sure. And then that reassures them, okay, what takes me there is going to bring me back. That's a good, that's a good way to kind of phrase it for people that they can feel a little bit more comfortable with it. What I notice that is so beautiful is there is a slowing down. And so their movements is this beautiful, almost like dancing hands. Everybody seems to like their hands kind of dance, but in a really subtle, beautiful, slow way. And so everything slows down. Everything slows down. And the mind slows down. And there's space in between that fast pace that we're used to. All of a sudden, the slowing down creates this beautiful opportunity of a space that half an hour before was not available.
So they can actually, at higher doses, you can be disconnected from your body, but at more medium doses, it can be something you really feel into your body and enjoying it.
And not necessarily into your body, more into your being. I mean, they can feel kind of dissociated from their body. It's more into their being, of their own aliveness, right? Their aliveness in the world.
I've been writing about cannabis and the endocannabinoid system for years. I've traveled the world to gather people's stories about cannabis and the history of our use of it. But at the time, the positive effects from CBD were only starting to dawn on me. Then I saw firsthand the impact it made in the health of my cousin, and the comfort it gave my grandmother as she was passing. Since then, the many accounts I've heard from those using CBD from hemp made me a believer in its potential. CV Sciences works hard to produce the highest quality hemp supplements, so people everywhere can experience CBD's benefits for themselves. I'm proud to be working with them to help spread the good work. Proud because I know we lead the industry in research and education. Proud because I know we make excellent CBD supplements from true agricultural hemp. But I'm most proud because I know our products make a difference in people's lives. At pluscbdoil.com, use the coupon code Lex Files for 20% off to see for yourself. Do you have advice you tend to give about how to prepare yourself for a session, especially for people who aren't used to altered states like these?
Mm-hmm. Yeah, I tell them, give them a little bit of an example about non-ordinary states that we tend to feel that are, states of being are like sleeping and waking and dreaming, and that's it, and that that you actually have an opportunity to see and to feel into all these other states that are much more complicated than we think because we don't live in them, and that and give them different reassurances. Okay, so like if you can talk to me, like let's say sometimes people have a hard time forming words. If you can talk to me, just raise your finger. If you raise your finger, it means you want contact, and I'm going to reach out and hold your hand, and I'm going to pay attention to all these little nuances in your body so that we can make an agreement on what's going to happen so that I can be right there to support that process for you. I think that a lot of ketamine, I have had clients that have been referred to me because they've had traumatic experiences with ketamine, and most of the time, and with MDMA or any psychedelic, and most of the time is because somebody was not able to hold a space that they needed to hold, and the person did not feel the other person there. They didn't feel safe in the space. And if you're in a non-ordinary state and you're not safe in the setting, that's trouble. That's really scary.
And that's actually something I wanted to ask you about, because one of the dangers of doing a show like this is having a bunch of people rushing off to a K clinic somewhere for a quick, expensive dive. And you hear pretty bad stories about how some of those places hold space and don't pay attention to dosage and can cause harm. And I just want to ask you, if someone was intrigued by this and using it for themselves, what would you look for in a caretaker?
Yes, that's a really good question. I think part of it is what is their intention, like their philosophy around ketamine? Is their philosophy that they want them to go as far as possible, like really be outside themselves and have this completely mystical experience, or like something way out there, and that's the goal? Or is the goal that I'm going to be right here with you and we're going to work together? And, it's not to say that one is bad and the other one is good. Is what are you looking for? And if you are looking for that higher dose to have that experience, is your sitter prepared to stay with you and to support you if you're in a really challenging, difficult space, right? Are they capable of holding that container? And if you want it to be more therapeutic in the sense that we're having this connection and we're talking and we're kind of working with what's happening in the moment, then finding a therapist that is more their inclination, and that they're leaning more in that direction. I do have a bias that regardless of what you do, that there's integration that happens. That is my bias, for sure.
It's good. It's something that seems to often not happen. Even when people in the underground are using these more spiritually for themselves and recreationally, you don't get a chance to integrate. You don't get a chance to talk to somebody about it. How important do you see that in your work with these various psychoactives?
I see it as just as important as taking the psychoactive drug. Just as important. Even if you're doing it for self-growth, that, because if you think about, and of course I have a bias because I'm a therapist, but so many times in my office, somebody comes and tells me a story and they say, they figure it out. They figure their own answers out. And why do they figure them out? Because they talked it out loud. Because they said it out loud to me, and all of a sudden they heard themselves say it and they went, oh my God, this is what's going on, right? That happens so much. And so just that, like being able to sit with another person who can really listen. It doesn't have to be that you need to be in therapy, but it's like, can I sit with somebody who can really just listen without giving me advice, without trying to fix, without trying to control the situation, but it's more, I can hear myself talk and I can come up with like, wow, that is part of the integration process, is that I say it out loud, I write it down, I read it to somebody, that there is a piece in hearing it out loud that helps the integration process.
Wow, for the self-growth people and for people coming for specific conditions.
I think so, yeah.
And what do you see people coming to you for the most in terms of what they'd like help with?
Well, I'm a trauma therapist, so I've been working with trauma for many, many years. And I mostly see people with trauma that have had traumatic experiences of various kinds, and so on the spectrum, up to severe PTSD. People with severe PTSD. Our studies are with PTSD and pretty severe PTSD. So that's mostly what I work with. I do have sometimes people that come in terms of ketamine for depression, and ketamine has been known to work with depression, and so that's they come for that sometimes, but most of the time is to work on trauma.
And so, as far as contraindications, physically it's a very safe drug, so it probably isn't as much in terms of medications you're taking and things like that. But what about for people with trauma? Are there certain things or symptoms you see where it's like, we might want to be careful here or perhaps not use this?
I would think so. I mean, I think in terms of like preparation, like with anybody, like maybe somebody needs a little bit more preparation in terms of that they are so unaware of some of their sensations in their body, that they're already so removed that they probably need some more work with it. I mean, one of the good things about using ketamine is that in the studies, for instance, with MDMA, and I would imagine so post-approval, is that we do want them to taper off their medications if they're using SSRIs, for instance, and a lot of different medications that we want them to taper off. Whereas with ketamine, you don't necessarily have to do that. You don't, if you're taking an SSRI, you don't have to taper off, so it's safe that way, and people can still do quite a bit of work. My preference is when they don't have, when they're not taking an antidepressant, for instance, because then it just seems like they can go a little bit further, or they can, the work can happen a little faster, that they go to that non-ordinary state. And
speaking of MDMA, how much more, I mean, MDMA I think it might surprise people, MDMA sessions can often get pretty challenging for people, even though it's supposed to be this love drug. It kind of gives you a safe container to deal with that stuff. How does that compare to ketamine with the amount of challenge that you see people? Is it generally gentler and safer? You can sit there and hold hands, or is it often a lot of intense work happening in front of you?
That's a good question. I definitely have had more intensity with MDMA sessions than I have with ketamine sessions. So I think MDMA has a tendency of you're connecting to yourself in a very linear way, right? It's very concrete. Wow, like I was disconnected in this way, or I have this insight of these patterns that I've done, or, oh my gosh, I am really in fear and I'm back in the trauma. And sometimes that happens with ketamine, but because ketamine is so short-lived, then it's faster that they come down from that state, whereas with MDMA, they can be there for many hours. So the challenge is time-wise, but I have seen similar intensity with ketamine.
And I would guess that it's also easier with ketamine in terms of the next couple of days effect. MDMA can cause 3 days later you're kind of down in the dumps from the lack of serotonin, but ketamine generally seems to feel like it gives people a small happiness boost because of its whatever causes its antidepressant effects that are so intriguing. Do people normally say that?
Generally, people do feel a sense of, I think it's like a sense of calm for a couple of days, joy. They can feel joy. But, I also find that with MDMA. I think a lot of times in our studies, we have not found that people go into that dip. And that if they do go into a dip, they go into a dip because of the traumatic experiences that have come up and the content that has come up during the session. And how am I now going to be in the world with this new understanding of myself? So I don't always see that. And I have seen that both. Sometimes it definitely happens that people feel a little bit more down, and that it could be because of the actual chemical. And I have seen that with ketamine as well, where somebody with ketamine, it could be one time, it could be the most wonderful experience and they feel so incredibly good and connected. And the next session they come out of the office feeling pretty crappy because of the content that came up and because maybe there's something there to be worked with, but it's challenging and it's not my preference, right? Like we all have preferences of what we want to feel afterwards. And sometimes it's not the preference, but it's still rich material to work with.
Yeah. And as they often say, there's no such thing as a bad trip, which I don't think is completely true, but I think in terms of therapy, it seems like those harder ones can often be the most valuable.
Yes. And I agree with you that it's not totally true, because I do think that if you don't have a safe container, it can be a bad trip.
And the hard part with ketamine is in the underground, it has such high addiction potential. It's often called the most addictive psychedelic, even though it's not technically a psychedelic, but of the main fun things people take, it's easy because it's so physically safe. People can be addicted for years at a time and just removed from reality. And it's very real, even though it's so good in so many medical ways. Do you ever have any problems where people take ketamine in a therapeutic way and are tempted to take it in a recreational way that isn't healthy for them?
I have never had that happen in the 3 years that I've used it, or at least that I know of. Mm-hmm. I think, of course, it is, and it can be very addictive. And I also think that I've had clients that have been addicted to ketamine or have taken it recreationally in a way that they feel, that they describe themselves as being addicted to it. Or at least they have a dependency on it. And they say, oh, this is so different. This is so different to use it in this setting, to have this intention, work on these issues, to explore, to integrate. This is so completely different that it just feels like a different drug. And sometimes it actually helps with that dependency, because it's like, oh, I don't want to take it that way. I want to actually take it in a safe setting with somebody who's going to be really watch over me and be there for me, and have this sense of connection and well-being between me and my sitter, but also between me and myself.
Mm-hmm. Yeah, you used the word calm earlier, and that has always stood out to me as one of the most remarkable things that ketamine causes. I think about psychedelics, and I think about going up to that, connectedness of all things, and that the classic idea. And with ketamine, it feels like you go inside as the higher parts of your brain shut down, and you get down to almost nothing, and it feels like a dive into your own little ocean, and it feels like a shortcut to the meditative state, just like psychedelics were a connection to the oneness of all beings. And with the hippies, once they saw the top of the mountain, they got sick of taking LSD to the top, and they figured out Buddhism and all these other ways to do it. And I feel like ketamine could be the same thing in terms of calming your mind, that people could see how calm your brain could be and start to cultivate that a little bit more in their everyday.
Yeah. I think that's what I meant by, like, it's sort of like a brain massage. Mm-hmm. It's like when you think about a massage, right, you come out of a massage and people immediately know, like, wow, what have you done? Like, you look so calm. Did you just wake up from a nap? They say things like that after a massage. So imagine that in your brain, like you're just massaging your brain, so your brain just settles down, and it's not so busy with all this chatter and with all this chaos. It's all that is gone. And I just have to be in this moment with the experience that is happening to me right now. So it is like having a brain massage, and it calming down completely, and the noise is gone.
Yeah, and actually some research just came out in the last couple of weeks. In sheep, they were looking at what their brain waves using ketamine, and as the dosage increased, the brain waves slowed down, and they actually got down to nothing completely, which is very rare. The scientists were surprised to even see it.
Wow.
And that's often what it feels like with this as well, to keep lowering the brain cycles down to that. And it's interesting because it feels like part of what it does is so just the nature of the drug itself. So many of its good things. And even in the underground, people don't take it. They take it for recreational use, and then it helps with an addiction problem or a relationship problem. The drug just does it on its own. But then in the hands of a therapist, I think it really opens up the range of experiences. And I think the neurochemistry actually reflects it. Like it's often called a pharmacologist's nightmare, because it's not just a glutamate thing. It affects a couple of the opioid receptors, dopamines, the serotonin receptor responsible for psychedelic effects, estrogen receptors. It's a long list. And when you hear about the recreational uses, you hear about people going in and using this in all of these different kinds of ways, whether to relive memories, to look for ideas, to look at themselves. And it seems like what a therapist brings out is kind of mapping what might be happening with the neurochemistry as well. And that's why they work together so nicely. Yeah.
And I think, some of the most profound experiences that I've seen is related to the way that we think and the way that we use our ego, the way our ego responds to certain things. And the beauty has been that it's almost like I have so many experiences of people feeling like, oh, there's this traumatic experience, I'm stuck, I want to do ketamine so that I can get unstuck. And this is where I get to, and then I stop there. And so I want ketamine to help me get past that door, right? But then when they're in the ketamine experience, what they realize is the way to get there, maybe it's not the same way you've always gotten there. Maybe if it's the metaphor of a house, maybe we're coming in the back door instead of the front door. Maybe we're starting with the back end of the experience, coming forward to see where it affected you. So it's this brilliant way of being able to soften the ego enough to say, hey, there might be a different way to approach this instead of the same old way to try to say, I'm going to just like drill through this door until I get across it. How about if we tried this other way? And so I think that ketamine provides the opportunity for that.
Yeah, new connections, which would also make sense. Some of the things it does is increases the BDNF, which increases neural growth. It might be that it fights depression simply by creating new brain cells, which is fascinating. And so I think if people are listening who might be recreational users, this might tempt them to try exploring this drug in a different way.
Yes.
Would you have any advice for somebody who simply wanted to do this by themselves for self-work?
Well, if they're doing it by themselves, the first thing, I mean, you have to talk about the legality of it, right? How do they get it? So it's not legal, probably, the way that they got it, but of course, I think that there is a way to do it. And what I tell people is, if you're going to do psychedelics on your own, just really make sure that you are very safe and that you have people that are going to be there if you need it, and that you just have things in place to create a container that is going to make it possible that people are not going to be, you're not in a situation where somebody's going to come knocking on your door, where somebody's going to come in, where you're going to be disrupted, where can you really honor the sacredness of it, of the experience that you're about to have, your own sacredness, right? Can you honor that as sacred and say, oh, if I go into a church, I don't listen, phones are not ringing, right? For instance, if you go into a church, it's like, okay, we're quiet. We're here to honor this. We're here to respect this space. If you are that space, if you are that church, how do you... there it is. That is perfect.
Well, we're not in church, at least not yet.
If you are that church, or if you are that, however, whatever you want to call it, that sacred space, how do you enter it and honor it so that you can have a profound experience that is not going to be distracted by other things? So make sure that you are safe. Make sure that whatever drug you're using is safe, that you have tested it, that people know what it is, that you know exactly what it is that you're taking, that you start slow, that you don't start with huge doses that are going to, then you're not going to be able to have a say as to what is happening when you're in distress, for instance. So be safe, for sure.
The one that's great advice. Thank you. And the only safety thing I would add to anyone is stay away from bathtubs. They are that's a notoriously unsafe thing to do when you might get disconnected from your body. Unfortunately, Marsha Moore, D.M. Turner, stories like that happen. And speaking of, you mentioned the legality side, and I might move on for ketamine for just the last bit of this. So if the world were sane and you could be working with any of the major psychoactive, hypothetically, which ones would most interest you to be using for your work of healing trauma?
Oh boy, I like a lot of them.
Amen.
Because I think that they all have their own wisdom, and they all bring us different information. And it's all information that is useful and helpful. And I think they all have a place at the table.
Then the last question would be about the one that you're doing so much to push forward. Could you just give us an update on what the status is of the MDMA research and how that's moving?
We're getting ready to start the second part of the last phase before we send it to the FDA for approval. And so this is a long-awaited time, and I can't wait. And so this phase will, I'm not sure exactly how long it will take, with COVID, and we had to put some things on delay, but it's the very last part. We've done the first part of phase 3, the last phase, and here's the second part of it, and that is going to be a very big celebration.
Wow, after all those years, MDMA is a legal drug.
Yeah,
allowed
I
for
myself
therapists.
have been waiting for over 35 years. So when the young therapists come up and say, "But I don't know that I can wait another year," I say, "Well, honey, I've been waiting 35, so you can wait one."
You will survive. Well, thank you so much for telling us more about this today, and for all the work that you do with these and spreading information out into the world.
Thank you.
Hello, everyone. As promised, I want to give a little bit more background on ketamine, because I do think it is one of the most fascinating drugs out there. And I'll start with the biggest misnomer. It's often called horse tranquilizer. That's what you hear ketamine being referred to as. That's incorrect, because it's not strong enough to work on horses. It is actually in veterinarians' offices, but it's only because of their work on dogs and cats and rabbits. So it's not a horse tranquilizer, it's a rabbit tranquilizer, really. But it also speaks to the extreme safety of it. The reason ketamine became such an important anesthetic across the world was because it didn't depress people's respiratory system like many of the other anesthetics would. So it is still the anesthetic of choice for young people and for older people, where you're going to be worried about their breathing. So there's a lot of children in the country who have to go in for surgery, and they have a ketamine experience. So they're coming out of surgery, and it's somewhat like they're coming out of a K-hole. So it's the reason that anesthesiologists generally tend to not love this drug, because it means when people are waking up, instead of kind of coming out foggy of a regular anesthetic, you're coming out of a very deep, sometimes psychedelic experience. And they call that emergent effects, quote unquote. But it's really the doctor's name for a K-hole that they don't know how to handle, and they're not very good at guiding people through. But it does speak to the safety of this. It's so safe that this is what we use on surgery for young people. And that was actually one of the first uses. So the history is, in 1962, it was discovered by a scientist named Dr. Calvin Stevens. And it was first tested in 1964 in prisoners, which unfortunately was a common way of testing drugs in those days. And there would be some kind of informed consent. They wouldn't just be dosing prisoners without their knowledge. But there would be rewards for participating in programs like that. And the idea that you can really have informed consent on a drug trial in prison would now be considered ethically dubious at best. But that's how it happened, and that's how we learned about the safety profile of it. And by 1970, within 8 years of its discovery, it was approved by the FDA as a drug. And it replaced another drug you might know, PCP. It's called angel dust. It's often referred to as a really scary drug. That was used as a surgical anesthetic before ketamine. And so ketamine is in that same class of drugs, so it's a rather different drug. And ketamine was amazing because it could put you under, and if they kept a drip in your arm, you could be under for 3 days, no problem. Your breathing wouldn't be depressed, and so the first widespread use of ketamine was in Vietnam, actually. That was when it really got tested in the field, and it became the staple drug on the battlefield. When someone was wounded and it was a bad wound, they needed to get them to a really good hospital, they would sedate them for sometimes days at a time until they could get them there and then get the surgery done. And until then, they could at least keep them calm and out of pain. So that was a huge revolution in terms of surgery. Now, doctors who do anesthesia tend to like things that are more controlled and measurable, and ketamine is usually for, as I said, the younger people and the older people. But it also means that the main place ketamine is being used by medical doctors is by anesthesiologists. So unsurprisingly, the highest addiction rates for ketamine among the medical community is anesthesiologists, because it's what they have access to. Other doctors tend to get hooked on opioids or the pills that they can prescribe and get their hands on. And so the best drug the anesthesiologist could get was ketamine. And you see a run of that in the medical community. And so this drug started off as a drug. In fact, by 1985, the World Health Organization put ketamine on its essential drug list. If you have to have a well-functioning healthcare system in a country, you had to have ketamine available. It was a bedrock drug for surgery by 1985. But it wasn't long until the underground use of this drug started. And it is a fascinating drug in its recreational effects too, because like many drugs, it has various levels of effect depending on the dosage. And I've heard it described as if you want to take a light dose of ketamine, because ketamine's a dissociative technically, that means that it is, if you might think of psychedelics as going up, dissociatives would be going in. And so it's kind of shutting down the highest parts of your brain. And so to take a light dose, it just shuts down, the very top functioning parts of your brain, a little bit like alcohol does. And people tend to feel good in their body, more at ease. People like to dance. It's a staple of of various music and dance scenes. That's what happens when you're taking a little bit, and people enjoy it for recreational use and being out. But then a medium level is more like a lay back, watch pretty animation, things that it's starting to alter. You don't speak as well, but there's an enjoyment of the world. And it's kind of a laid back, lazy kind of feeling. And then at the highest levels is when it can resemble a psychedelic's effects. At the lower levels, it feels more like a dissociative, kind of putting a buffer between you and the world. But the highest levels, your brain is so shut down that you can completely experience ego loss. And you're just floating there feeling nothing, and all these visions are passing by, and visuals. And some people even use this as a way to go and get information, or to learn things, or to work on their own psyche, as Marcela was talking about. There's a lot of underground use of people using ketamine to heal themselves as well. And in fact, addiction is a big use of ketamine as well. Krupitsky out of Russia studied the use of ketamine for alcohol and got really strong results. You hear a lot of strong results for ketamine in the underground literature as well. It's also, ketamine is most known for being used on depression. There's a lot of interest in the last 10 years or so on using ketamine for treatment-resistant depression because the data has been so strong. It hasn't been universally strong. How well ketamine works for somebody with depression is very personal to the person, and also to how well their doctor works with them. Some people with treatment-resistant depression need a couple of ketamine sessions over a 6-week period, and then they're good for a year. And other people might just need one session and they're good for a couple months. And other people might need every 3 weeks they have to go in and get it topped up to just get themselves feeling more normal. And so it is not, you need someone who's skilled if you're going to be using it for depression work, it seems like. One where you don't need as much skill, but it's very helpful, is pain. There's a lot of people with chronic regional pain syndrome, which is often called the cluster headaches of the body. And it's just crippling pain all over the body, and often people don't know where it comes from. There's no way to stop it. Opioids don't touch it. But for some people, ketamine makes a really big difference in their pain. So there's a lot of people who survive car accidents or have genetic diseases where they're taking a sublingual tablet of ketamine sometimes every couple of hours, and that's the only thing that's helping to control their pain. And so in line with that kind of stuff as well, PTSD and anxiety is another two areas of research that people are really interested in ketamine about. And so that's a lot of different things that it's being looked at. And the experiences that you hear from people, if you want to go read online accounts of it, are also all over the place. And so how does that happen? And I think what's happening at the biochemical level is really fascinating. As you heard in the show, it's often called a pharmacologist's nightmare. And in one sense, at least we know the main mechanism of action, and that is that ketamine binds to the NMDA receptors and means less glutamate in your brain. Glutamate should be one of those sexy neurotransmitters that's on the news, like serotonin and dopamine. Glutamate is your most common excitatory neurotransmitter in your brain. So basically, when a neuron wants to say yes, pass on the message, then it uses glutamate to do so, and its antagonist is GABA. So those are the excitatory and inhibitory. And so when ketamine lowers your glutamate levels, it's a little bit like turning the lights down on your entire brain. So at a little bit, your brain's slightly turned down, and a lot, it can turn it down to where there's very, very little activity, both experientially and if you were in an fMRI machine as well. And so that's the main thing that we know where it binds to. But as I said, there's a whole bunch of other spots. It binds to 3 of the opioid receptor types. It binds to 1 of the dopamine receptors. It binds to 1 of the serotonin receptors, but it's arguably the most important one. It's known as the 5-HT2A receptor. And that is the psychedelic receptor. When people take LSD or DMT from ayahuasca or mescaline from cacti, or psilocybin from magic mushrooms, all of those molecules bind to other places in the brain, but primarily they bind to that serotonin receptor 5-H2A. And so that mediates the psychedelic experience. Ketamine also binds to that. So it makes sense that for some people, that psychedelic response is very strong, and ketamine is sometimes called the most addictive psychedelic. And even though neuropsychopharmacologists would not call this drug a psychedelic, they would call it a dissociative, it in the common parlance, it's often lumped in because a little bit like MDMA, it's one of those drugs that tends to be safer physically and can cause very intriguing mental results. And so it makes sense that it binds there. It also binds to the muscarinic acetylcholine receptor. That's the one that receptor we only found from the Amanita muscaria mushroom of Russia. So another famous drug, the shaman mushroom of Siberia, and that's also where ketamine binds. Ketamine also binds to an estrogen receptor, which is intriguing. It's a reuptake inhibitor of serotonin, norepinephrine, and dopamine, and so that means that your brain will break down less of those molecules. So just like SSRIs inhibit your brain from reabsorbing serotonin and your serotonin levels gently rise, ketamine seems to be doing that for your serotonin and your dopamine especially. But the glutamate effects overall are the most strong. And so that is a lot going on at that level, and you see it causing all of these physical changes all over the body. We know that pain transmission is lessened when people are on ketamine. Pain transmission through the spinal cord itself simply goes down because of the drug. You do have to watch out because it can stimulate the heart and raise blood pressure. It is generally seen as safe to combine both recreationally and medically with most things, but you do want to watch out for that heart stimulation. Sometimes people experience GI problems in their gut, nausea and things like that. That could be related to the serotonin receptors because you have so many serotonin receptors in your gut as well. It causes bronchodilation, so your lungs are more open. And it also increases the level of something called AMPA. And AMPA is a drug often linked to depression, and the increasing of it being something that helps. So one downstream effect of AMPA is in the limbic system, kind of our emotionality system, and there it increases BDNF, and that is a brain growth factor. So it could be that one of the reasons ketamine is helping people with their depression is that it's simply helping them grow new brain cells. Not all of this and how it works in humans is completely known, but the clinical results are really intriguing in all these different ways. The big caution is that as safe as it can be in the acute, it is actually can be a very addictive substance when used recreationally. You hear about it over and over again if you're out there interviewing people about this stuff. You hear about the EDM scene specifically. That was a scene where people were using psychedelics and MDMA mostly, and then ketamine kind of infiltrated because it got more popular in London and then spread to the States. And ketamine is seen as almost an infector of a scene because people start taking it out there, and because it's an anesthetic, if they take too much, they fall over on the floor at the show. And they won't die. They actually can't die unless they're in a bathtub, which is a big thing to watch out for. But it's not good to be having that happening at parties. And the problem is that people start to like it so much that they stop going to the parties. They stay at home and start doing lots of ketamine by themselves or with a small group of friends, because what ketamine can provide is, if you want it, very strong avoidance. Because it's this nice, warm, fuzzy feeling, you can use this to not really face the problems going on in your life. And as you kind of come back up out of it, the impulse to not feel those things and to take another line is very strong. And so your body can't get that addicted, but your brain can be incredibly mentally addictive to that. And so Unfortunately, at really high levels, people start to actually destroy their bladders. We don't know exactly why that's happening, but you can read a lot about that in London, especially in the heydays of ketamine. And people are taking large amounts, 5 grams a day. For recreational users, 1 gram is probably enough for a small party to do, for a night. And so this is 5 grams a day for months at a time, sometimes years at a time. But at those levels, it starts to corrode the bladder, and you have 18-year-old kids who are needing bladder transplants. So that is one of the big negatives there. So it's fascinating that it is in itself very addictive and something to watch out for, but also very, very healing, and can be used as something to help people through their addictions to opioids or alcoholism or depression or PTSD as well. And so all that to say, this is why I call ketamine one of the most fascinating double-edged swords that we have in our pharmacological toolkit. So I hope this episode sparks some interest about ketamine, and you can do some more of your own research to see why this is such a fascinating psychoactive. Thanks for tuning in. To listen to other episodes, find us at pluscbdoil.com/Lex Files. If you have any questions, compliments, or suggestions, feel free to write me at research@cvsciences.com. If you enjoyed the program, please rate us on iTunes and share a link to your social media. It means a lot to us. The Lex Files is produced by Matt Payne. Our chief advisor is Amabel Dela Cruz. The music is by Jake Bradford Sharp. Our sponsor is CV Sciences, maker of America's favorite CBD oil. And remember the coupon code LEXFILES. I'm Lex Pelger, signing off.